So the Eastern Cape COGTA department is appealing to parents and guardians to monitor the health of initiates after 23 of them reportedly died in the December season. In some of the incidents, reports seen by Newzroom Afrika say that the cause of death ranged from breathing problems, dehydration, and in one case, a traditional nurse was stabbed to death by one of the initiates. Nkululeko Nxesi is the executive director of the Men and Boys Foundation. He joins us now for more from Matatiele, where he is monitoring the initiation season. Nkululeko, thanks very much indeed for joining us. I mean, it's incredibly disturbing, just the number of boys who have died reportedly in this initiation season. But tell us about the beliefs or what you're hearing insofar as the causes of death are concerned.
Good morning, and thank you for having us. Yes, the causes of death, they range to various issues. One, you've mentioned the issue of dehydration, and there's an issue of ill treatment of certain initiates. And also there's a lack of medical care, even when some initiates they want it. Or sometimes because of fear of stigma and discrimination, some initiates will just refuse, to be given medical care because they will think that they are not going to be regarded as men enough if they accept it. But also, we must mention the non-visibility of the medical staff in many initiation schools, because government has taken upon itself to intervene and help in this instance. Yes, we know that initiation practice does not belong to government, does not belong to traditional leaders. It actually belongs to the families. But the fact that government has even developed laws and regulations, it means they were committing themselves to assist. So those are the causes. Those are some of the causes. Of course, we've seen cases of recircumcision in certain areas. This happens when a number of boys have been circumcised medically, maybe in hospitals, when they go to initiation schools because they didn't follow cultural practices. In some instances, which is very sad, they are being recircumcised. So those are generally some of the causes of the death that we are seeing in Eastern Cape.
Wait. So, Nkululeko, can I come in there for a second? Because what you're saying is so incredibly worrying. You're saying that the boys whose families choose to have them circumcised, perhaps in a hospital or in a private medical setting, they are then taken to the initiation schools and they then face all kinds of pressures because they had the surgery done privately. Are they re-circumcised? Is that what I heard you saying?
You see, to a certain extent, there are those cases, but to a certain extent, is the medical circumcisions that in most cases were done without the consent of their parents. I think that's a topic for another day, because there's a story underneath this story, because there are many cases where boys have been taken from schools, that is your ordinary schools, without parental consent, circumcised under this program called medical male circumcision. And these boys, because they have not been done in a cultural way, and now they are being stigmatized in the communities. Then they attend initiation schools, and some they will actually ask that they must be recircumcised, and some they will be recircumcised because they will be regarded not as men enough. And of course, we have reported this matter to the National Department of Health for many years. Because some of the boys that have been amputated is as a result of this. But when they then succumb or they experience problems in the initiation schools, or they die in the initiation school, it comes as if it's traditional surgeons or traditional nurses that are killing these boys. And yet now it's a hybrid, it's a combination of all these factors.
Yeah. I mean, I'm looking at the report into the deaths of some of these young men and boys, Nkululeko, and some are as young as 15 years old. I mean, what is the responsibility of the initiation school itself? Because the boys are clearly under a lot of pressure, because this is a rite of passage into manhood. They are trying to assert themselves in a particular way. But what's the responsibility of the people running the school to ensure that when they need medical help, they get it?
Well, as I've said, that responsibility lies to everybody who's involved in the practice itself. It lies from the government, the traditional leaders, and the traditional practitioners. Because if the government was resourcing traditional leaders enough, if the government was giving traditional initiation forums that they do monitoring throughout the country, they were given resources by government, they will be able to detect these issues, very early. But also the other point that I wanted to raise is we must not lie to ourselves and say the Eastern Cape province is homogeneous in terms of how it's practicing this culture, because different nations in the Eastern Cape or throughout the country, they practice this culture differently. In some areas, you will have, it's a norm that the boys, they go in that age. What is important is that government must actually develop bylaws that will be in line with the practices of that particular nation, and then so that they can get a proper buy-in. Because once now you come with a policy that's called a one-size-fits-all, and trying to impose what is not working in a particular area, we are going to have these kinds of repercussions. So what you are saying is that there is a law, there are regulations that say initiation must happen to a boy who is 18 and above. That government must be able to monitor, it must be able to police, it must be able to resource those that are involved to monitor that policy. But also the government must facilitate the process of developing bylaws. People, communities in Matatiele, they do initiation school differently from communities in Queenstown or Mtata. Now, what you need to do, you need to understand those subcultural practices and affirm them and work through them. What government is doing is trying to completely erode the traditional initiation and replace it with the medical and male circumcision, and that is causing this problem.
Nkululeko, it does feel like not much has shifted in the discussion around initiation season every single season and the number of young men and boys who are dying. All of the issues that you've mentioned, I feel like we've had this discussion before. What needs to change so that we don't see this kind of loss of life?
Okay, you see, the first thing that I think it must change is that government must stop embarking on cultural re-engineering. It must integrate the biomedical interventions in a cultural and human rights sensitive manner. Because what they are doing now is that they are completely dislodging traditional practitioners who are not necessarily the problem here. But what they must do, they must make sure that there is a process where traditional sort of surgeons and traditional nurses, they work along with the medical team properly. And also we must use medical doctors who have undergone the practice, because it doesn't work to take a doctor from Gauteng who knows nothing about initiation and then you dump him in Eastern Cape to say he must come and assist. But the other point is, there are these NPOs that are running medical circumcision programs, because they are after statistics. They are not after promoting the culture. They are not after helping the health of the young boys. They want states so that they can claim from PEPFAR funding and so on and so on. So those NPOs, they must be told that they must respect the culture, they must respect the human rights of boys. Of course, we are calling for the commission of inquiry. You are right that nothing much has shifted. However, I want to say, there was a period where we were beginning to see the decline. There was a period where we were beginning to see communities being competent about handling this issue. What has made us to backtrack is the introduction of this medical male circumcision in the traditional initiation. It just through all the work that the good work that was done by the former minister, Dr. Aaron Mutwaledi, back. The other thing that we want we're calling for is that government must restore and empower traditional leaders, because you've got a very useful resource in the form of traditional leaders, but the powers have been taken from them because they are not given money to intervene in this manner.
Nkululeko Nxesi, let me thank you for your time this morning. He is the director at the Men and Boys Foundation, the executive director. In fact, heartbreaking time, especially for the families of those 23 young men and boys who have reportedly died in the December initiation season.